Now I'd like to really dedicate some time to sharing clear instructions and information about what to expect once you've taken a dose of cannabis medicine, and how to really gauge its effects to better know if you've taken enough or too much at any point in time. The onset time for effect is different for each intake method, so I'm going to be talking about inhalation, sublinguals, and edibles. I'm not going to discuss topicals as there's no absorption into the bloodstream and therefore there's no psychoactivity. So when you're first starting to take cannabis medicine and working towards a therapeutic dose, there will be some experimenting with dosages and number of times each day that you'll be taking your medicine. To help fine-tune this, we recommend that once you've set yourself up to take a dose, having optimized your inner and outer environments, you have your medicine measured in accordance with your personalized prescription and get it ready to take before you sit down and get in a comfortable place regardless of your intake method. Be ready to put your attention on two things once you've taken your dose. The first is your body sensations. That can be anything that you become aware of in your body. Notice if anything within your body changes, both towards the positive end or towards the potentially more challenging sensations. This can be a reduction of pain, maybe greater ease when moving some part of your body, potentially a slight loss of coordination or dizziness, maybe an ease of breath, sometimes less smoothness in your breathing. It may be that you observe no impact in your body whatsoever, and that's okay too. So the second thing to pay attention to is your emotional state, your mood, and your mental clarity. You may observe greater calmness or potentially a feeling of relaxation, maybe a more positive outlook or some sort of euphoria, maybe sudden joy or simply the urge to smile, perhaps some mild anxiousness or disorientation or some slight fear or potential fogginess. Once again, you may experience no changes, and that's fine. Just feel your body. Now, for each intake method, there's a series of steps that we recommend you follow. To make it really clear and simple, we've created a series of handouts that walk you through the clear step-by-step instructions on how to gauge the effects of your doses for each of the main intake methods. It will be helpful for you to have a stopwatch or clock, and this helps you actually track the effects you're having over time. While we've created a handout per intake method, there are a few things that I want to share with you now that apply overall. Take your prescribed dose as it's stated on your prescription. Super important. Stop and wait the suggested time. Make sure to do this every time you take a dose. Observe the slightest changes in your body, emotions, mood, and your mental clarity. And if you notice any changes, no matter how small they are, stop and go about your day until your next scheduled dose, and then repeat that process. If you notice no change, then after the suggested waiting time, have another dose and repeat the instructions until you notice the smallest change. Go about your day until your next scheduled dose, and again, repeat the process. Remember when taking medicine that less is more when you're working towards finding your therapeutic dose size, and starting low and going slow is the key to success in that process.